Hey, what's up, everybody? Welcome to the Unconventional Therapist Guide to Nothing. My name is Dave. I'm joined here with my co-host, Greg. Greg,
hmm
what's up? Before we even get started, I just want to say I apologize if I'm a little off today. Yes, I got hit with the glorious stomach bug the other day, and I spent 24 hours and more sleeping after being sick in the morning.
Violently ill.
Yeah.
Violently.
I got lucky because I only got like physically sick once, and then I just felt like super nauseous and queasy and tired the remainder of the day. I've literally never slept an entire day. I lost an entire day of my life.
You don't
So
hear queasy. You don't hear queasy too much out there
no,
in the world.
I don't know a different word to describe what I was feeling. It was super uncomfortable. And yeah, and but like
That's kind of the worst thing. Do you feel like maybe you should have puked more?
I
And that,
wanted to really bad. I
mm,
normally would. I would normally just make myself, but I decided I wasn't going to do that this time.
yeah, you weren't going to force it. You're going to let things happen naturally. And maybe that's
And,
part of,
and I regret that.
uh, yeah, right. I mean, maybe there was some acceptance involved in that.
Yeah. I've done that in the past with the stomach bug, and it really doesn't help because you still feel it's not like drinking where you like get it out and then it's
Yeah, yeah, and you
done,
feel fantastic.
Yeah.
Although I will say, even with the stomach bug, that first 7 minutes after you throw up and you get that light, cool sweat on you and you
All
lay
my
down for a second, it
I
feels
was
good.
literally laying on the bathroom floor in that heavy cold sweat. It was not a
Yeah.
pretty sight.
No, it doesn't
I
sound
was
like it.
like, yeah, it did not go well.
Strange phenomenon, like things you wouldn't let touch your hands and face unless you're very violently ill. You'll
Yeah,
touch the
I did.
toilet,
Yeah,
you
I
know what I
laid a
mean?
towel down, but I was like, I had that much thought, but that was about it.
You're like, this is good. I'll just stay here. This is a good
So
place.
so this is like a treat for me to be on here tonight because I spent the last 2 days just kind of like laying low. You can still be, be contagious following it. So I didn't want to like
Sure.
spread it to the world.
We all
So I
appreciate
get
that.
the pleasure of chatting with Greg.
Yeah. Hey, look, welcome back to the world. All right.
Yeah. Suck it up,
So,
kid.
you excited for this one, Dave? This is one of
Um,
those ones that we got to hit, I think.
no, not at all. This I was actually dreading this one
Okay.
because it's a lot. It's a lot of information to give. Uh, People know this material pretty well and will probably critique us, I assume, like they
Oh,
usually do.
look, here's the thing. This is one of these therapies that it's so dense that you're probably doing some of it if you're doing therapy by accident.
Yeah,
But there's just so much, there's so many acronyms, there's so many things you can get involved in with this thing where it's like you can never do it. This is literally like we'd have to do like a 4-part series to kind of nail everything down on DBT.
seriously, we would. And
Yeah.
there's numerous ways we could have broken this up, and I do think that we'll have future episodes that will touch on parts of this. I think even the developer we'll probably have an episode about her at some point because she has an
Yeah,
interesting story.
she does. Very
But
Buddhist.
for now, we will just talk about the overview of dun, dun, dun.
DBT. I haven't got these. Oh, you can't see it. Damn it. Well, they're dialectical behavior therapy cards, which I
Nice.
actually really love. They've been super helpful to me, like learning about this too. But
Cool.
anyways, yeah, DBT, Dave. And I guess I'll get into
Oh
this
wait,
thing.
you had to learn about this? You didn't just know it? Wow.
Yeah. Yeah, and you know what? I will use components of this, and like I said, like I do already without even kind of knowing it. But the actual procedure of DBT is something that I don't think I'm interested in. It can be really in depth, and like you have to sort of, I mean, be
Yeah.
committed to a patient, really committed.
Well, we can talk about the procedure part later because I do want to also share a thought I have that pertains to you about
Mm.
the procedure
Oh yeah,
and
I
your
already know.
thoughts
Trust me, I
about
knew it was gonna
DVD.
come. I
Yeah.
knew it was gonna come up, like how I'm like sort of doing DBT by accident all the time.
Yeah, but not even that.
Oh,
Well, I'll get into it later.
okay, all
But
right.
yeah, because this is such a dense episode, I guess we should probably get started.
Yes.
Greg, why don't you give us an overview?
Okay, so first of all, when I think of DBT or when I've heard
Oh wait,
about it,
have we said what DBT stands for?
dialectical behavior therapy.
Dialectical. Right
Yeah,
there, it's like over people's heads.
you've already lost me. So we'll get into that D word too, so don't worry about it. When I thought of it though, it's almost to me like when people brought this up, Dave, it's like synonymous with borderline for me. Like, you know, anytime you hear someone be like, "Oh, they have a borderline personality," that you assume that someone's doing DBT with them, but that's not always the case, right? And it's sort of like developed for that, but also it's useful to everyone, and it's useful to people who've experienced big, huge emotions or lingered in the negative too long, which we talked about before, or not long enough with like the good, positive emotions. So part of it's obviously going to be regulating your emotions,
Yeah.
right?
You know, it's interesting 'cause you said that how it's synonymous with DB with borderline. And ironically, that was never my connotation at all with it
Really?
because I always used it or thought of it in the realm of working with people with developmental disabilities because it
Oh.
was um what would you how would you say it? Designed also they designed the program to be able to work with that population. So that was always my familiarity with it.
Well, I mean, look, it's for a lot of people. It's for people who need to develop their interpersonal skills, that's for sure. People who have difficulty, Dave, with distress tolerance and urge control. So you know it's going to be useful for people who are drinking, who are cutting, shopping, whatever kind of, they have this adverse reaction or this maladaptive treatment to their thoughts and their emotions in a way, right? And it's born out of cognitive behavioral therapy, obviously. But what I find interesting, Dave, is like I was thinking about this when I was doing a little reading here. So CBT tends to lean towards, you know, dealing with thoughts and behaviors, right? Or even specifically thoughts a lot of the time, right? Like, and then ACT is kind of more about behaviors. So we're focusing on the behaviors. And to me, it seems like DBT is very much focusing on emotions. So with the three of these things, you got the CBT taking care of the thoughts, you've got the ACT taking care of the behaviors, and DBT taking care of the emotions. And it's such like a great, well-rounded thing that they all kind of should be used in tandem in a sense. And I think in some ways they are,
I
right?
really, really wish, for the sake of this conversation, there was also a BBT,
DBT and BVDs like the underwear.
Belle Biv TiVo,
Yeah. Belviv, Bel, BV,
BBT. We needed
BVT,
it.
CBT.
CBT, Oh, ACT. Never mind. That
Yes, that's right.
that ruins the mold. Never mind.
So I guess essentially though, when you see like DBT and CBT, it's replacing the C, cognitive, with dialectical. So dialectics is essentially this idea that two things can be true at once. So, actions, and we're gonna get deeper into what the dialectical portion of this is, but like actions have a reaction, and it's this like paradoxical thing of suggesting that nothing is really bad or good. Like it's like looking for why something happened. It's like if you're fighting with your mom, it's like I'm mad at my mom and I don't like my mom right now, but also my mom loves me. And like why is she doing this? Like you know what I mean? It's trying to see like both opposing sides. Like understanding that two things can be true at once, even though they can kind of be like opposing, right?
Yeah. We've talked about this a number of times in the past
Yeah.
too, the dialectical thinking, but for people who are newer to the show and haven't heard us have that conversation, it's also often a way to almost defuse the way you respond in conflict
Yeah.
because you start to think about, all right, this is how I'm feeling about this, but how do I challenge myself to try to see where they're also coming from? Why might they be having the conclusion they're having?
That's a perfect way to put it. So instead of, assuming that this thing that you think is going on with this person is the absolute truth, it's like stepping back and observing it, observing the process and trying to understand like why, like where are they coming from? Like why is this person being this way? Or what, like almost trying to like defend them in a sense. And we'll get into that
Yeah.
down the road a little bit. But DBT itself, developed by Marsha Linehan, and you'll get a little bit more into Marsha there. And you can do that right now, I guess.
Okay.
Right? Yeah.
Yes. So Marsha Linehan, she earned her doctoral degree from in clinical psychology from Loyola University in Chicago in 1971. During her doctoral work at Loyola, she studied suicidal behavior and provided treatment for those at risk of suicide. In 1972, she accepted a position at Stony Brook University, where she studied behavioral therapy. And she ended up accepting a faculty position at the University of Washington in 1977 and has worked there developing and researching and implementing DBT for nearly 4 decades. So she's pretty heavy in the work, I would say.
Hmm.
And, she ended up revealing there's a reason that she is so heavily invested, I think, in this work. And that reason was as a teenager, she had been a resident at the Institute of Living and was which was an inpatient mental health hospital for over 2 years. She
Wow.
she spoke about severe mental health issues that she experienced as a teenager, suicidal behavior being among them. Although she wasn't diagnosed with BPD at the time, the account that she provided of all of her symptoms pretty much aligns with what the diagnostic criteria for borderline would be in today's mental health treatment system.
So she's like
So
one of these like people like who get an illness and then become a doctor to fix it.
it's inspiring, isn't it? Though,
Yeah, it
like
is.
to think about that, and for so many people, we always talk about how a lot of the people in the field, ourselves included, have experienced something that inspired you to want to do the work, right?
Hmm.
So we've talked about our stories briefly in the past, and this is just another case of someone, but her experience with mental health, clearly a very significant one, to be living in a resident at a hospital, in a residential hospital for over 2 years. That's a very long time.
That's a long stay and I like a very rare thing, I think. I mean, it's a
Absolutely.
long-term stay. I mean, that's a whole separate unit that you would be in, like a long-term care psychiatric hospital, as opposed to just like med management stabilization, maybe 2 weeks, 3 weeks, maybe even a
Sure.
month sometimes. But like, geez, 2 years, that's pretty
Yeah.
intense.
So she's studied DBT throughout her career, and she's trained a number of mental health professionals on its use. And she's expanded the use of the treatment to address now eating disorders and substance abuse. She's published, extensively in scientific journals, uh, multiple books, including manuals on the use of DBT for practitioners. And then she founded the Linehan Institute. Is it Lineman? Linehan.
Yeah.
All right.
Linehan.
Linehan Institute, a nonprofit organization dedicated to education and research on compassionate and scientifically based treatments for mental health conditions. Behavioral Tech LLC, a company that provides training and consulting in DBT, and Behavioral Tech Research Inc., a company that develops online and mobile technologies used to improve evidence based psychological treatments. Essentially, this woman is a genius in business.
Mhm. She is a business genius, and she's developed something that's like when you look at these like useful sort of workbooks she develops, it's like, man, these are like play by play. You can really use these in therapy, and there's so many interventions, there's so many
There is.
I mean, there's so many, yeah, and like we can never even really get into them all. It's like books and books and books of them, and they're all pretty useful too. So, I mean, you just can kind of like it's one of those fun things where you can kind of go through it and be like, I could see myself using this. This kind of hits with me, and this doesn't, right? And you can just put it down.
I would love to have seen that moment when she realized that she created something that was going to be this successful and be able to branch off to this many business opportunities.
I know she's rich.
Is she like Oprah rich or
Yeah,
what?
she's rich, dude.
Wow.
Yeah, she's doing pretty good. So, I mean, but look, she's saving lives. That means a lot. And so, like, what is this thing, and like, what is it used for? How does it work? So, it's used for, and you mentioned, like, something I haven't really thought of, and maybe even like autism and things like that, right? But I mean, like, what? So
No,
there's
I
that.
mean, so people with, let's see, not just autism. Like I've used it with people with
Like
various
intellectual
development,
disabilities.
intellectual disabilities, but also, like conduct disorder,
Okay,
mood
that makes sense.
disorders, things
That
like
makes
that.
sense. Yeah, because look, when you think about conduct disorders and like borderline and self-harm and suicide is a huge part of this, like suicidal ideation, PTSD, substance abuse, and now you're mentioning eating disorders. Just prior, she's like added that on too. These all share something pretty significant in common, and they all stem from this unhealthy coping strategy,
Mm.
right? Like a way to control our or avoid our negative emotions, intense negative emotions. Like this is gonna find healthier ways to do that, like discovering like where the need to cope comes from, and then finding a more adaptive way to cope with these issues. So like that's when like the distress tolerance and like urge control stuff comes in. And of course you can use this for anxiety and depression, obviously too, because why the hell not, right?
Right.
But like ultimately, the goal, and it's very Aristotelian and Buddhist, is just to find balance, right? Like just to find balance between, what's, I don't know, essentially like who you are, like what's challenging you and the benefits for change. So like that's sort of the acceptance part is like, hey, look, this is just kind of partly who I am. And this is what I'm going through, and this is the challenges. Like not so much I need to do this for this person or I need to do that for that person or like it's stop worrying about that and then like what could the benefits of change be? So with DBT, you're going to learn, mindfulness, obviously, because that's going to be a part of every form of therapy, I think, from now forward. Distress tolerance, interpersonal effectiveness, and emotional regulation. And I'm going to break down each one of these in a little bit here, Dave, unless you have anything to add right
There's
now.
also like a really heavy ACT aspect
Totally.
within like making choices and decisions. That idea that I should be making choices that are based on my values and weighing pros and cons of things and having just looking at things in a non-judgmental way. That's a big piece, which I'll get into for the radical acceptance. And that was very ACT based, it felt like.
Yeah, no, and it's also CBT based because think about the dialectics of this is it's like the synthesis of opposites, but it's also saying think of these situations with in these interpersonal relationships and the difficulties that you're having as shades of gray, not black or white. That sounds very CBT. And also what you're talking about with the radical acceptance, that's psychological flexibility. That is, you're right, very ACT. Um, so I think like an intervention of like this could be you make like the dialectics part that we're talking about, like make a list of people, like let's say like you're not too fond of, and then name three positive qualities about them, and then like that you can see how that like you got to take some space to agree with something that they're saying, and then you something it's just something like I don't know, it's hard to explain like you make a list of things saying that this is how they're not the problem. Or you make a list of things about yourself saying this is not a problem. Like I don't have smallpox, I don't have this, I don't have that. It's like it's just a way of like kind of um, separating yourself from the issues. But let's talk about like mindfulness as an intervention here. The mindfulness part of it is this when we choose to be aware of a moment on purpose, like non-judgmentally, that whole Jonah Kabat-Zinn thing, where you focus your mind where you want it to be. And I often call it like space from thoughts. And you can do this in any way. You could be meditating on a rock like a Buddhist, or you could be jogging, or you could be cleaning your house. It's just very intentional practice. And Marsha Linehan has this thing, like something I've never heard about with a mindfulness practice. She says using it a Teflon mind, and it's also the Teflon mind thing is also this Mel Robbins thing. I don't know if you've seen this come out a lot, where it's just like this let them theory. That's a whole new
Mm.
wave of like therapy thing coming out too, but it's just to not react to potentially stressful situations or criticism, and you just don't let them stick to you. And I call it a slick mind. You just let things like, like kind of almost visualizing the things that are people saying that should bother you, just like kind of like wash off you, you
Yeah.
know? And then so like, what do we do?
Are you proud of yourself?
Yeah, slick. Yeah, I like that one a lot. But so now let's get into distress
So just so
tolerance.
everyone's aware, slick mind isn't actually a thing. Greg just made that up,
That's
but
true.
it's his wording on it. If you want to
Yeah,
use
that's,
it,
I mean, what do you think though?
why are you just giving it to everybody though?
I don't know, it's just a good
You're
visual.
you're terrible at that stuff though.
I know.
You give your ideas away
I know. Well,
for
look, hey,
free.
look, we're just trying to help. Well,
There's no copywriting.
I'm not a business person like Marsha Linehan. This last,
She wouldn't give you slick mind.
no, she wouldn't. She says
She'd
Teflon mine, and I'm like,
she'd patent it and then give it to you.
she might steal it.
Yeah.
And then I'm gonna have to have a slick mind about it. I'm just gonna have to let it roll off. So, distress tolerance. This is very useful, you could imagine, for, I don't know, everyone. So, like addicts, NSSI or cutting, porn, like we talked about just recently, anxiety, a whole like exposure to anxiety is all about distress tolerance, isn't it? Essentially, like it's there's this thing where like I was just talking about this and I might have talked about it on the podcast where I think about it as like the usefulness of a sauna or a cold plunge is like part of that is you put yourself in these difficult situations and then it helps you develop more like better coping strategies. Now think about it like this. Like let me see. Like there's this great acronym that she uses and it's called accepts. And it's a way to sort of you first you come up with activities and then you contribute like and that means like contribute to society, contribute to your friends, whatever. um Emotions, because we're gonna throw emotions in just about everything, but it's not about pushing your emotions away, it's just about like putting them away in like I don't know, dude. I'm in the weeds on this one. All
It's
right.
like putting them away and then shoving them really far down and never
Yeah.
acknowledging them.
Yeah,
I
yeah.
don't think that's it.
But essentially though, she does say that as a part of this, where it's like not shoving them away where you can never sort of see them or like feel them again, but putting them away for later.
Okay.
You know what I mean? Does that make sense? Where
Sure.
like it's almost like we've talked about before with CBT, like scheduling time for your emotions.
Okay.
Yeah, in scheduling time to worry and schedule time, like I think that's where she is kind of coming with that.
Hmm.
I mean, it's all part of distress tolerance. I guess part of distress tolerance has to in some way be distraction, not avoidance. Does
Yeah,
that make sense?
distraction is part of it. Yep.
You know,
That's definitely a component for it.
and then like the whole accepts acronym, I think it's kind of interesting because there's this great quote by William James, and it says, "The first step in overcoming any misfortune is to allow it to be." So like I love that because acceptance isn't giving up or giving in. It's just like acknowledging reality. Like some things are going to be hard. Some things are difficult, right?
Yeah.
And I think that's,
Can I make a request?
sure.
When you say a quote, can you pause after you say the quote to let it sink in?
Oh
I
yeah.
feel like every time you say a quote, you then quickly give your explanation, and I haven't even fully processed the quote.
Dude, you know what? I
You're
I
welcome.
appreciate that. That's actually good because I would like that too. You know what I mean? If someone
Yeah.
else was saying a quote. So another intervention, and I'm sorry, it's getting very wordy, but it's emotion regulation. I won't take a lot of time on this, but I like to think of emotions like the weather. They're very temporary. They come and they go.
Mm.
And the idea of emotional regulation is like you decreasing our vulnerability to negative emotions and increase the benefits of positive ones, right?
Yeah.
And part of like regulating your emotions, and I know it's like a duh thing, but like exercise, eating right, diet, these all these things.
I hate it.
I know, but it's true though,
Yeah.
especially sleep, right?
Yeah.
I mean, they all influence our emotion, and I think like understanding how temporary emotions are is like a hugely important thing that we forget, right? We think that like the negative emotions are going to stick around forever, and we think that the positive ones are very fleeting, and it does kind of
Right.
feel that way.
Sure.
But I mean, that's just like how the way we approach them. Like we can extend the beautiful emotions, and we can try to limit or shift focus from the negative ones. It's just something that we have a little more control over, and it's just about acknowledging it and practicing it, I think.
Yeah. It's that thing we always talk about where you have to remind people where our brains are wired to look for the negative. It's like we're constantly trying to point out the negative things, but we have to actually try and put effort in to point out the things that are good. So the more we can do that, the more balanced we'll start to feel.
Yeah, absolutely. And the last component of this is interpersonal effectiveness. And Dave and I have been we're doing interpersonal work for kind of a while now, and it's like this is one of those things where it's hard to sort of quantify if you're doing well or whatever. But I'm like, what is the point of interpersonal effectiveness? And I think, you know, it helps you maintain relationships, obviously, right? But I think more honestly than that is, and let's be honest here, like it helps you get your needs met and what you want in life. Like
Sure.
being able to deal with people, everything's run by people. So if you can do better with people, you can kind of do better in life,
Yeah.
right?
The thing that I've learned about interpersonal effectiveness is it is about identifying what those boundaries are or those barriers that you're putting up that is prohibiting people from fully being able to know you and
Mm.
you from fully being able to know other people. It's something about your interaction style that is either pushing people away or yeah, just that's it. It's pushing people away or it's just putting up a barrier that only allows them so far in. So working with people on interpersonal is about identifying what that is and trying to do away with it.
And that's why all the other components all kind of work together with that. Because I think ultimately the interpersonal effectiveness is the most important thing, almost the goal.
Yeah.
So that's why you're going to work on your distress tolerance. That's why you're going to work on your emotional regulation so that you can put yourself in these vulnerable situations and kind of whatever is that thing that Dave's talking about that's getting in the way of your relationships or getting in the way of you being vulnerable, like you have a better chance of being less fearful of that
Yeah.
and like being more vulnerable and letting people in a little bit.
I'm just want to point out something that's happening literally as this episode is going on. That's I guess us kind of trying to be more mindful. I think as we both came into this episode, this felt like a very daunting topic.
Hmm.
And I think we both started to get very in our heads as we were
Totally.
talking. And I noticed when I did my little Marsha Linehan bio, and I noticed while you were, and I wrote you a note so that you could that we're both kind of not in the moment as we should be, and that's why this feels so wordy to us, and we're kind of getting lost even in our own words. So as I said that, I noticed we both kind of just locked in a little bit more and became more present. So it's interesting how just like redirecting yourself can
That's
cause
true.
that change and you can perform totally different once you get into that moment again.
And like even in that moment, I have to say to myself, I'm not like, oh, Dave's saying I'm not doing a good job in this podcast. I have to say what's Dave's motivation of saying that? Well, we want to do a good podcast. He wants me to sound like I'm with it, and I want him to sound like he's with
Right.
it. Like that's what the goal is here. And so like no,
Not
that's
non-judgmental. That's
non-judgmental.
yeah,
Like let's just what is he trying to say here? Like not what do I
good
think he
point.
means? It's like
Sure.
what is he trying to say here,
Yeah.
right? So
Yep.
that's and like kind of don't ju look for the gray area, and I think that's like a huge part of this.
Yeah, good point.
So now I can talk about the procedure in a much calmer way, I think.
It
I
feels
really
better
do.
too
Yeah,
right
I do.
now.
Yeah.
I feel better too now that I like
I do too.
more
I honestly
focused.
do. Like I feel like just some therapy happened. And I will say this, the procedure, I can do this really quick because it's kind of it's a simple procedure, but damn, is it involved. When you think
Mhm.
about if you're a therapist about to be working and you're thinking maybe I'll be a DBT therapist, just tune in for a second, just to kind of like not to say that I don't want to like turn you off of it, but hear what it is. So the first thing you're going to do like a pre-assessment, and then you're going to talk about what this is going to look like, if this is even appropriate for you, like a discussion, just like you would have with any other form of therapy, like that meeting, and this is what we're going to do, this is what we're going to try. Like, are you up for this? And then you're going to do therapy sessions weekly. And so far, that sounds about right. So far, like you're on par with us, right, Dave? That's what
Yeah.
our lives kind of look like. And then on top of the weekly sessions, you're going to do a DBT group, which isn't like group therapy where you're kind of like trying to just, pointing out issues with each other and kind of maybe creating some conflict and learning how to resolve issues in the group. It's not like that. It's more of like being in a classroom where you're learning skills and you're kind of learning together. You're reacting with each other, but it's not that kind of group. It's more of a educational group, which I think is I kind of like that. But that's on top of the weekly sessions. And then on top of that, you are doing some telephone crisis coaching. So as a DBT therapist, you're kind of quote unquote always available for support sessions between both this group and the individual sessions. And so I think that this is one of my would be a limitation for me because I have difficulties establishing my own boundaries. And that's not to say like inappropriate. That's to say that I've almost in the past made myself too available because I think I think I can help everyone. And sometimes uh, when I do that, I put myself in this position where I'm like not helping myself, and then no one's really gonna get any help.
Yeah.
And I've
And
noticed that
and you
about me.
can the view of who you are, or the role you are in that person's life can change, which can
Totally.
also make you less effective.
Absolutely. Absolutely. Like when you become sort of like
The friend.
the friend. Yeah. And everyone needs a friend. I mean, there's a role for a friend, but the therapist has to be something a little bit different than that, I think.
So just two things. The phone session, the phone crisis thing. I'm familiar with that from doing some research in DBT years ago. And I want to say there is some rules around that, like when its uses for. And I think that like it's almost something, if I can remember correctly, if you violated something that you're working on, you're not supposed to call, or the you're not there, or vice versa. I
I
can't
know.
remember exactly. There is some like stipulation of why you would call. It's not just you could get calls around the clock, as far as I'm aware. The one thing I wanted to say though, and if this is what I think Greg gets you caught up sometimes. So yes, there's the DBT's like style therapy that you just described, but there's also DBT skills,
Hmm.
and those are way more common for therapists to utilize and be, you know, have as part of their repertoire, or things that they say that, I'm a DBT skills based therapist, I guess you would say, or something along those
Totally.
lines.
Yeah.
Because
Yeah.
I mean, I definitely use DBT uh, strategies very often, but I'm in no way part of like a structured DBT program. So I would definitely consider myself at times to be DBT, to be part of my regimen, but like I'm not a full fledged DBT group therapist.
Yeah. And
So
I
you just
think
got to
that
kind of separate it a little bit. You know what I mean?
look, there's always going to be things like if you have a joke book, right? I don't know why I'm thinking about it like that. I haven't had a joke book probably since I was 9 years old. But when you're going through that, you're gonna go through and be like, ah, that one's for me. And, like say like you're going through a list of jokes, or even yeah, we could keep it
I
with the
feel
joke book.
like you probably have one next to your toilet that you read when you're in the bathroom.
Yeah, I wish I did. I'm going to get one soon if they still have those. Now you can just go online. But do you know what I mean? How like you would read through those, and every once in a while you'd be like, oh, that one
I'm
kind of
going to
hooks
use
me.
that one.
I'm gonna use that one, right? I mean, it's kind of
Yeah.
the same idea. Like I think that's what DBT, even CBT and ACT is for me. Even though I think that maybe I closely align more with ACT at this point than anything else.
Sure. But
Uh,
even when we started, and we were probably more connected with CBT at the moment,
which I'm still very connected with.
we in no way are CBT therapists,
Mm-mm.
because we don't do the big CBT style therapy that's very
You're
quick
you're out the
acting.
door in 12 weeks.
Yeah, we don't do that.
Yeah, 8 weeks
So
even.
again, we're like CBT skills therapists,
That's
DBT
it.
skills therapists. Yeah.
Yeah, I agree with that. I agree with that. So you talk about these skills. Maybe we
Yeah,
hear.
so there's a few skills or strategies that can be used. Wise mind. I just quick anecdote here. I mentioned my history with this being through a population of individuals with developmental disabilities. And actually, I remember I worked with an individual who I would take to a place, I think it was called ICS in Cranston. It was or Warwick. It was on Jefferson Boulevard. Dating myself, I don't think it still exists, but they specialized in using DBT with individuals who had intellectual developmental disabilities, as well as either sex offending behavior or pyromania.
Yeah, limiting those like maladaptive behaviors.
So
Urge
those were the
control, disorder
two
loss. Yeah.
specialization populations within IDD that they served. So I would take an individual who had a history of sexual offending to that. And wise mind was actually a phrase that I remember very well. He would talk about wise mind quite a bit. And I thought it was crazy at the time. I was very young and I didn't understand any of
Yeah.
this. But now
You're like,
that
I
I
don't think
actually
you're
know,
using your wise mind. I,
now that I know what it means, like it makes a lot more sense in the way he used it. I don't think he fully understood what it meant, but yeah, that was an interesting individual I worked with. Anyways, wise mind is based on the concept of three states of mind. We got emotion mind, reasonable mind, and wise mind. So if you were to consider a Venn diagram, you got those two circles that are overlapping. One circle is emotion mind, the other side is reasonable mind, and right in the middle where they overlapped is your wise mind. And it's so funny because I always talk about emotional minded individuals and I called it rational minded, but I guess it would be reasonable minded. And I kind of thought that that was my own concept that I had been talking about. Then I'm like, oh no, this
well,
actually
I
went
bet you
right in
Marsha
here.
Linehan thought it was her own concept before she read Freud, id
Yeah,
ego, super ego. I mean,
probably
you know,
that this is something that like individuals having two separate ways of thinking is something that I hear a lot about with like couples and things like that.
Mhm.
So, but this is talking about within ourselves, right? The wise mind allows for a balanced approach to problem solving and decision making, taking into account both your logical reasoning and your emotional intuition. So it refers to the logical and analytical aspect of thinking. So for example, looking up the bus schedule before walking to stop and wait, that would be logical, right?
Mhm.
Planning for an outing several days in advance, that's logical. Measuring the ingredients to bake a cake, that's all logical things.
Sure.
While emotional mind represents the emotional and intuitive aspect. So, fighting with someone you disagree with, taking an impulse trip without planning, cuddling a puppy, flying a kite for fun. I mean, these are all things that our rationale for doing them are all based on emotional feeling, right?
Yeah. And it's funny that you like as I'm like reading this and the emotional thing, while it can be completely distressing and kind of destroy your life, emotions are kind of what make life great too. You know what I mean? Like
But if you're more of that reasonable mind thinker, it
yeah.
drives them nuts. If you rely heavily on reason and mind, you're like, what are you doing? You know what I mean?
No, I do.
There's
Yeah,
the
absolutely.
people. You're right though. Emotion mind people are like, this feels great
Yeah, yeah, yeah. Or this
sometimes.
feels awful.
Yes,
Yeah,
exactly.
yeah.
So purely relying on logic may result in detached and robotic actions, while solely relying on emotions can lead to impulsive and irrational decisions. So this is considered to be the optimal state of mind, where rational thinking and emotions come together, helping to make decisions that align with our values and goals.
So this is where you can hear her like Eastern philosophy, like sort of coming through in this kind of stuff.
Absolutely.
You know what I mean?
And
Right. It's
it's
like balance and
it,
Tao,
you're 100% correct. Actually, that's you're getting into this. It's based on several qualities, balance being one of them, clarity, the ability to see situations clearly and objectively, intuition,
yeah.
authenticity, like encouraging individuals to act in alignment with their authentic selves and their values, compassion. So it fosters empathy and compassion towards oneself and others, promoting understanding and acceptance.
Oh.
So very interesting things that it's based on. I really like that. It
Yeah, I like
played,
it too, where it's like Young did this too. I mean, they all do it, right? But he
sure,
did it in a way that was like a wicked pain in the ass, where it's like he had like however many archetypes, and it's like, are you being balanced with all these different parts of your personality? And I think breaking it down to just a few parts of personality. I mean, like you do have to give credit where credit's due. This is very Freudian. Like this is his kind of wheelhouse too, where it's like the id is the emotional mind, or I mean, he would kind of be like the drive, sexual desires, whatever. I mean, still kind of emotional. And then the superego is that like super judgmental, the way things should be, very rational
yeah.
only. And then you're in kind of in the middle, balancing, trying to balance them
I
both, and
mean, I feel like all of these are just expanding on ideas that have been, laid out before them, or maybe
sure,
guiding them in different directions, or correcting them, or tweaking them to make them feel more authentic or more
Yeah,
contemporary to the time,
approachable, right? Like it's
approachable.
yeah,
So, mindfulness plays a key role in accessing the wise mind. Paying attention to the present and accepting in without judgment can lead to the ability to become more aware to thoughts, feelings, and bodily sensations. I kind of feel like we had to be mindful for a second when we were talking on this episode, so we could be more in the moment and accepting, and have a freer flowing episode.
Totally.
It's mindfulness is considered the foundation for accessing the wise mind and making balanced choices. Another aspect of this is non-judgment observation. So it involves becoming aware of thoughts and emotions without labeling them as good or bad. By doing so, individuals can gain a better understanding of themselves and their experiences, and this helps reduce self-criticism and promotes self-compassion.
So there's
I
been,
I love
yeah,
that, because you know how many times someone will come in and they will say like, "Oh, I did this weekend," or "I had this happen. I'm like, I know that was wrong of me," or that was such a terrible thing I did," or "I shouldn't have said that." It's like, why do we have to pass that judgment? You're just
I know.
telling me about how this went. Why do you have to judge yourself based on this thing that happened right now?
It's a like that non-judgmental point of view, I was gonna say too, is like it's so hard. But when you're that's like the best way to approach like intrusive negative thoughts too, where like you're just letting them be and you're not judging them, you're just kind of observing. Observing is a very important thing. Like observing instead of like being all caught up in emotions and thoughts is very important. And also something else I noticed while you're reading this, it's like she's like, all right, use mindfulness when accessing the wise mind. It's like she does this all the time with like once you know the four components, um she's going to use them in like almost all the interventions too, where it's like use wise mind for this, or when you're doing, you're going to talk about opposite action. When you're doing
Yeah.
that, make sure like distress tolerance is going to be a part of that. It's like it's all interwoven like pretty nicely, and builds on itself. It's actually really, really in depth.
And one of the things I think is the most challenging for individuals is getting to a point where you actually can stop yourself before you make an action, make a decision, say something. It's hard to stop yourself, especially if
Yeah.
you're in the more of the emotional thinking, or if you're feeling a big emotion. So working on that is really important. Mindfulness plays a big piece of that. It allows you to kind of slow down a little bit and make better choices. Another method she has is called the tip method. So
Okay. I
you
think I've heard of this.
you take a step back is the
Yeah.
T. You identify options, and then you pick in um, a pros and cons list. You pick from a pros and cons list,
He
and
has,
I'll do that quite a bit. Go ahead,
yeah.
Greg. Go ahead.
No, I'm sorry. I was just saying to say like has another there's another so accept isn't just like something that's an acronym and it's got all that whole thing too. And
Yeah.
improve is another one
Right.
that she's
Right.
got all lined up. But yeah, no,
So
I let the
the
tip method. I
acronyms
haven't
are,
they're wild throughout this whole thing.
yeah.
Tip method, take a step back, identify options, and pick pros and cons list. That's a mindfulness practice.
So I do the pros and cons list quite a bit with
Yeah.
people, and actually that I think that's in CBT as well. There's some of that. That's really effective for people. People enjoy that quite a
Mhm.
bit once they actually, because we'll do that when we're reframing thoughts too. We're rationalizing thoughts. We'll do the pros and cons, or the no, we'll identify the truth versus try to identify the truth in the thought and the fiction in the thought. So it's kind of like that. But people just like making lists, I think. And when you can
Yeah,
put it out there, it's or just even like make that mental list. Sometimes it can be really helpful when you're moving forward. So I think that's super important.
I like it.
Opposite action. This is one we've talked about in the past.
Love this. Might be my
Yeah,
favorite.
it's definitely it feels very accessible, which I think is a big part of it. So it encourages us to act in the opposite manner than our mind and body seems to tell us to do.
Mm.
At times, the best way to deal with an intense emotion is to engage in actions that are opposite to the urges those emotions prompt. By deliberately choosing an opposite action, you can avoid impulsive and unhelpful behaviors, strain relationships, and reduce overall well being. This is a hard sell to kids. I know
It's
this
also
from
everyone.
experience. I think adults, it's a little easier because they've seen the patterns of their
Mhm.
actions and they're there for a reason. So they're trying to get help and make better choices. Kids are usually there because their parents are telling them to be there, and they don't necessarily see these patterns in their behaviors or
Yeah,
care.
yeah,
and
right.
and also there's a bravado thing, especially with male youth patients. So it's like, I'm not going to let that person beat me, or I'm not going to let them bully me. And that's a really hard sell. So a lot of times I'll have to do some visuals I do the puppet thing a lot, uh,
Oh wow.
puppet on a string thing a lot.
I got Mr. Rogers over here. What's that?
So I'll draw a picture of like a puppet with strings and then like
Uh,
a hand that's
ah,
kind of controlling the puppet. You know what I mean?
I do.
What do you call that?
A
The
marionette.
wooden things? Yeah, a marionette. So
Yeah.
I'll draw one of those, and I'll tell the kid that like the person being bullied is often the puppet because the bully is trying to evoke a response. So in order to not allow the bully to control you, you have to cut those strings, and you have to think about what behaviors might help you cut those strings.
Can we call it the Pinocchio effect?
The Pinocchio,
Pinocchio.
because
Geppetto.
oh no, I wonder if that's not copyrighted anymore. It's probably in public domain now.
Could be.
They're making a horror movie about it, probably.
It predates Disney, obviously. So
Yes,
I don't think they pay for any of that shit. They got that all from the Grimm brothers.
it is off. It
Yeah,
is
gotta be.
off free market,
So
whatever.
I see opposite action working, and I'm gonna get back into it, obviously. But where it's most easily used, I think, is depression. Because it's not like
Yeah,
so
it's like
it's almost
behavior.
hard to
Isn't that
like
behavioral activation or
yeah,
part
in
of
a
it?
sense. Where like yeah, absolutely it is. But when you're saying like, hey, act in a way different than what your mind and body like was kind of telling you to act, it's like, well, that's only when your mind and body, it's ego dystonic, like it's just a term we talked about before, where like your mind and your body is like, stay in bed and fucking don't move and just you don't want to brush your teeth. And that doesn't go along with your values. So your body's kind of telling you to do that, but like, so do the opposite even though you don't feel like doing it.
Yeah.
That's when it's like, that's kind of easy to follow. And then with like exposure therapy, it's there. That's kind of there too. That's opposite action, isn't it? Like I don't like driving over bridges, so drive over a bridge.
Was it the depression episode where we talked a lot about opposite action and we talked about the essence and I talked about using visuals of
No, that might have been
horror villains?
we literally did one the whole episode either it was either the Scream 3 one or it was a Final Girl
Oh,
maybe
maybe it was the Final Girl one actually. Yeah,
maybe good
possibly. There
some
was
good
a whole
stuff
episode. Yeah,
some
so
good stuff on this thing.
if you haven't listened to those episodes, I definitely suggest digging down because we talk about a lot of when we were, you know, had enough time to kind of develop our own approaches at
Mhm.
times.
We were trying.
We were trying and we threw some of those in there.
I sent my an approach to therapy towards Dave. I don't really heard anything back
You
yet.
didn't send, I didn't get it.
I sent it to you.
Oh, I'll have to look again. I don't think I ever got it.
Oh,
I don't know
maybe
what
in your
email
text
it.
messages.
Did you
Yeah,
probably sent it to the wrong email?
great.
I know you did actually. Now I think about it because you've done it before. All right.
Oh, great.
The opposite action technique in 3 steps. So first, identify your emotions and triggers. So you got to be mindful of challenging emotions as they arise, label them. Awareness of these emotions will help you identify the possible trigger and thoughts about the trigger that lead you to the physiological responses. Then you want to notice your thoughts. Once the challenging emotions are identified, examine your automatic thoughts you had in the response to the trigger. Be careful not to dwell in these thoughts. Rumination is a key cause of poor mental being.
Yeah,
That's
don't spend so much time in your. So we talked about like hot tubs and saunas and all that stuff. Yeah, they're all healthy as long as you don't spend too much time in them. Your mind's the same way. Don't hang out in there too long.
I thought you said hot dogs.
Yeah, don't hang out too long in hot dogs.
Yeah, definitely no. And then lastly, pick an opposite action. So paying attention to your physiology, which may include heightened heart rate, rapid breathing, or muscle tension. Examine your behavioral urges or reactions, which could include shouting, stonewalling, or self-isolation. Consider what would be an appropriate opposite action to them, such as like maybe taking a break from the conversation, going for a walk, talking to someone new, etc.
Yeah, and you can see how the things we talked about before, like distress tolerance and emotional regulation and those mindfulness, even those practices are going to be super helpful during all this.
Yeah. Here's a couple of examples. So, if, anger gets us ready to attack, makes us, want to attack or defend. The opposite action could be showing kindness or concern
Yeah,
or just
yeah.
walking away.
That whole image of like that hippie putting a flower in a rifle.
In a what?
Opposite act. You remember that? You know that image of like a hippie putting a little like flower inside of a rifle?
Okay, yeah.
You never seen that?
Yeah, probably.
Yeah, that's kind of opposite action, don't you
Sure.
think?
Yeah.
Yeah.
Um Shame, it makes
Oh,
us want to hide and maybe like want to isolate. So opposite action would be raising up your head. giving eye contact, shoulders back, making super intense eye contact to the person who shamed you.
Oh, yeah.
They didn't see that one coming.
Or are you shamed? I don't know.
um, so fear it makes us people want to run and hide. It activates us to want to escape danger.
Hmm.
Instead, go towards it,
Hmm.
stay involved in
Carefully.
it, build courage. Yeah, unless it's like a real danger, then get
I
going.
mean, let's use your wise mind during this.
Yeah, please.
Yeah.
But yeah, I think you guys get the idea. And then the last one I'll talk about is radical acceptance. I mean, this one kind of speaks for itself, but I'll go into it a little bit. So it involves acknowledging the painful situation and accepting it without resistance. This is very ACT to me.
Very easy there.
Yeah. So the philosophy underlying this approach is rooted in the understanding that while pain is often an unavoidable part of life, suffering is a choice, just like ACT explains. So by choosing to accept the reality of the situation, we reduce unnecessary mental suffering.
Like almost like I can't fix all this. And then once you kind of say that, like this is part of me. This is who I am. I
Yeah.
can't fix all this. Like what can I fix? And like what are the benefits of that if I do fix that? It's almost, you know what I mean? Like there's certain things in life you cannot change and you have to be okay with that. Like I have tinnitus in my ear.
You do?
Yeah, so does Stephen Hayes, and that was a part of like I really liked him a lot because he talked.
Oh, humble brag. You and Stephen Hayes have tonight.
Me
Wow.
and
I
Stephen,
like how you just
hey, we have
threw
the
that
same
out there.
illness. You know what I mean? Great minds, you know.
Didn't
And
did Van Gogh?
Van Gogh, no, dude, I don't know.
There was there was somebody that was a notable figure that had some kind of tragic ending that I believe also had it. I can't remember what it was.
Well, Van Gogh did cut off his
I
ear, but
know, I
he
know.
was also schizophrenic.
Are you
So
that too, Greg? Do you have that in common
I
with him?
I don't think so. I'm not artistic either, so we don't have much in common at all, me and Van Gogh. Other than I think he was had male pattern baldness.
Your pattern is just completed.
Yeah. 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 The pattern is there's no pattern. I've reached completion.
Oh boy.
Yeah. I
All
don't know.
right.
That doesn't sound good either. Jeez, falling apart.
So
And you know what? I accept that.
good job. So there's two phrases, concepts in radical acceptance. There's willfulness and there's willingness.
Okay.
So trying to change a situation that cannot be changed is referred to as a form of willfulness. Radical acceptance is introduced as a skill to counteract willfulness, promoting a more open and accepting mindset. So willfulness refers to a state of mind or set of behaviors characterized by stubbornness and resistance. It involves an insistence on having things go a certain way, even if they may be impractical or impossible.
Hmm.
Willingness involves an open and accepting attitude towards the present moment, a readiness to engage in effective coping strategies, and a recognition that certain things are outside of your control. To me, those two words feel confusing because I
Me
would
too.
never think of willfulness in like a
As a
not a
negative
positive.
thing.
Yeah, I would
Yeah,
never
I
think of it
know.
not
I never think
positive.
about that too. It's a tough word. She just wanted to go. She likes the alliteration in a lot of this, that's for sure.
Yeah.
So, I mean, to me, that's very Wu Wei. That's like Taoist principle
Yep.
where it's like, just don't try, just let things kind of like wash over you, and then like you can, you know what I mean? And that I don't know.
So here, so
There's a usefulness to that.
maybe you'll feel differently if you hear a few examples. So,
Okay. All right.
so willfulness could be like resists and struggles against reality, often desiring it to be different. A willingness acknowledges and accepts reality as it is without necessarily approving or disapproving of it.
I would say like a resistance instead of a well, you did say resist. Maybe that's where I'm getting that. But like willfulness is it's not working for me.
So with flexibility, it might someone who's willful has willfulness might be rigid and fixed in expectations, reluctant to consider alternative perspectives, while someone who has willingness might be adaptable and open to various outcomes, willing to adjust expectations based on changing circumstances. So as I'm explaining these, I was like, this sounds nice. I don't like we're saying, we don't necessarily like the wording.
Yeah, that's why he like Hayes nailed it with flexibility. Like psychological flexibility versus psychological.
Yeah.
what's the other word? Inflexibility. But what I mean, like impervious,
Rigidness.
rigidity,
Yeah,
psychological
rigidity.
rigidity.
Here's a uncertainty. This is a good one for anxiety.
Okay.
So the willfulness way of looking at uncertainty would be experiences discomfort and anxiety in the face of uncertainty, seeking immediate resolution, while someone who has willingness embraces uncertainty as a natural part of life.
Maladaptive versus adaptive.
Yeah. So I don't know. I like the premise here. I
I
like
do.
radical acceptance is nice. I think all of these, the important thing to remember is they take time, they take practice. There's a reason the DBT type therapy is so involved and so in this in like there's a lot to it
Yeah.
because I mean these are things that you're basically trying to change the way your brain is operated for however long it is operated prior to trying this. So it's
Yeah.
not going to be a quick adjustment, but I do think there's a lot of good that can come from, engaging in DBT work.
1,000%. I like certain things. Even like going through these little cards and I have we both have the same book and
Yeah.
I went through that quite a bit.
Yeah.
But even that was like this is like it was overwhelming where it's like where do I start with this?
So what I'll do with individuals I work with at my other job is we break it down and we might do like a mindfulness group
Mhm.
and we might do, a distress tolerance group. So we
Yeah,
break it down into sections and, it makes it way more digestible for that population, but I think for a lot of people it'd be way more
absolutely.
digestible.
Like an emotional regulation group and
Yeah.
then
So
an interpersonal.
like one of the things, we could always do if we ever were able to form a group that was lucrative. We could
Heard
do
it's
a
not. I heard it's not.
DBT. I heard it's not too. We could do a DBT skills group. That would probably be really, really good because we could, consider the aspects that we want to have involved in it. That would be really nice.
Yeah, what I'm really looking to do is try to like simplify the process of therapy as much as I can with the most useful and I want to like employ all your like the smartest therapists I know, and I don't mean that in terms of just like mental acuity because like I want to know what you're like I want to like go through some of this like what I use and get your take on it. I wish there was some way that we could do that more, like
Mm.
just have like a group of therapists kind of talk about what's been the best for them and kind of like what can we pick off of each other?
Do you think some therapists are competitive?
I mean, I think that would defeat the purpose.
Yeah, it would. But it must happen.
Absolutely. I mean, competitive how? Like,
Maybe unwilling to share some of their skills, some of
oh
their.
man, they're in the wrong field, I think. Because
But
isn't
doesn't the world or the way that it's compensated almost promote competitiveness?
I guess so. Not where we because in our it's never been that way for us because the only way it would promote competitiveness in our world is if like we're scrounging for people.
Yeah, but we're in like a microcosm because no other place I think exists like ours where we have nonstop
Yeah, we're
referrals.
like
I
enough
mean,
already.
yeah, I
Yeah.
mean, there's probably a few others, but for the most part, I actually watched an ad on social media the other day, and it was like, "Are you looking for more referrals?" It was basically to help
Yeah.
therapists
You're like,
gain
not
more
really.
clientele.
Looking for less referrals.
Please slow it down.
But at the same time, yeah, because I think we both feel that way. We always have that urge, almost a responsibility to help. Like I meet people all the time at the hospital, and I'm like, oh man, this person would hit with Dave or Anna, and that's basically it. I mean, it doesn't go too far beyond that. Or me, I'll pick up you know what I mean?
Yeah,
I've
yeah.
definitely done that too.
Oh, so I was gonna say that that's a hard thing saying no when you're asked if you can pick up a patient. I hate that.
Hmm.
I was also going to share. I actually lost my first patient recently, like a month or two ago. Lost as like they left me as their individual counselor, but not for a bad reason.
Oh, they died.
No, no, I know. I realized that after I
You
said
gotta
it.
watch the
Sorry
way you
about
say
that,
things. I
everybody.
mean,
No, they left me because they actually have been struggling with their BPD quite, excessively, and they've decided to look for a DBT based therapist,
Okay.
which I obviously am not. Like we've been
No,
saying,
but see, that's the
I
thing.
just I didn't even know, is there one in Rhode Island? I don't even know if there are. Sounds like I understand. And they, it was a very,
And I gotta be careful with how I say this. But with the nature of the presentation of borderline personality disorder, that's once you kind of give that availability of
yeah, but you would imagine because it was formulated for that population, it must
oh, it's
the,
necessary, right?
the boundaries must be firm enough that it
Yeah,
doesn't
yeah.
feed into the. I get exactly what you're going to say,
Mm,
so that it doesn't feed into some of the tendencies or
mm.
the,
Like
yeah,
attention seeking or like,
just that need for
yeah,
the affair of abandonment and stuff like that.
fear of
Yeah,
abandonment and like yeah, like the
yeah.
approval and yeah,
So I'm
reassurance.
I'm assuming that it's, if it's
Well,
formulated for that, that it would be.
I would think, you would
Yeah,
think,
yeah.
we would think. So yeah, all right. Well, I
All
think
right.
like
Yeah,
like again, we were kind of like we glossed over so much that there could be, but this is a good bones to DBT. I think you kind of have the understanding. To me, it's an emotional based therapy, and it's like fixing your interpersonal skills, your behaviors, and even your cognition through addressing your emotions. I think that's kind of where this is, where CBT is addressing your thoughts, somewhat of your
yeah.
behaviors, and ACT is focusing mainly on those behaviors in a sense. So it's like if you say like your basic mental illness is a combination of thoughts, behaviors, and emotions, then you just choose which whenever you want to start with,
Sure.
right? I mean, isn't that kind of the truth,
Yeah.
right? With the idea being if you heal one, the others kind of have to, be affected.
So that is our DBT bones overview.
Yeah, I think like it's harder to address an emotion than it is to address a thought or a behavior though. But and I what do I know? Just saying. Anyways, what do you think about that? Just real quick.
So the populations that it's for, though, Greg, I think,
Highly emotional.
and might have less insight or awareness to their thoughts.
And the behaviors are so sort of emotionally gratifying
Yes.
that it's difficult to work with just cognition. Yeah, dude, interesting.
Yeah.
Very interesting. Okay.
That's like, all right. So, perfect example. Why do you think that my familiarity with the population I work with people with IDD, would use DBT? Because have you imagine, trying to use CBT with individuals
Hmm.
who lack the insight to, how many
I
times it's
know.
like, oh, why did you do that? I don't know. And then
No
it's
clue.
real. They something, a
Yeah.
lot of times they really don't know
Yeah.
what thoughts were going on before, they
And
don't
then when you get,
retain
or
them.
it's easier to be like, when you feel this, when you give into this emotion,
But that's,
what's
yeah,
the
that's something
outcome?
that's easier to
Yeah.
understand.
Yeah.
Yeah.
Um, Interesting. Okay, cool.
All
That
right.
helped.
Yeah. Okay. Well, thank you everybody for taking this dive with us. I hope that this was
DBT.
helpful. This DBT dive.
I did it the bow thing
Oh,
for you.
BB, BBT.
DBT. Like you see,
Um, like we said, this was daunting. I definitely was dreading this, but I'm kind of glad it's over.
Mhm.
So, for the people who recommended this, I hope that this was helpful. And for the people who didn't recommend this and are now listening to it and like, what the hell did I just listen to?
Yeah.
We'll
Bunch of
do something
acronyms.
different next week. So, don't worry about it.
Yeah. Tell us a story.
So, just a reminder, we do have the Patreon up and it is flowing. We got a couple of bonus episodes. We're going to get another one up there pretty soon. So if you want to, make sure you check out the Unconventional Therapist Guide to Nothing on Patreon. This is also the Apple subscribe. You'll get the bonus episodes there, but they won't be videos. So if you want to see the video versions of them, get on Patreon.
Yep.
Also, please leave a rating, review, subscribe, hit the bell if you're on YouTube, all that stuff if you can. It's super appreciated and it helps us grow, which is super important because there's no point in us talking if nobody's listening. So we really, really appreciate all the help with that. We did get a couple of ratings but no reviews recently. So
Mhm.
love to hear the reviews just because it selfishly just
It's motivating.
it feels good.
Hmm.
It feels super good.
That's right.
But I do appreciate everybody who has already done so. And our boy Tyler up on the Patreon, who's been super interactive and shared some interesting stories. So I appreciate him a ton. And I also want to give a shout out to all the people that he works with that get to listen to us on his Bluetooth. But
Yep.
also, Tyler, make sure they subscribe as well, man.
Also, just do the opposite action of what you've been doing with the reviews lately. So
Yeah,
you haven't been
you know
bothered
that
with them
urge you
much.
get to not do them? Just think
Yeah.
about the
Go ahead
opposite
and try
action.
it. See what happens.
All right, everybody. We'll be back next week. Have a great night. See you later. Bye bye.
Goodbye.